Hi, everyone. Thank you so much for joining the webinar this evening. We will get started in just a couple of minutes as we wait for a few more people to join. And if you wouldn't mind just typing yes in the chat box if you can hear me, I just want to make sure that my audio is coming through. Great. So it looks like everyone can hear me, so that's good. And hopefully y'all can see the slide as well. So we'll be going through a few slides as we discuss everything tonight, but we'll give it just a couple more minutes and then we'll go ahead and kick it off. All right, so let's go ahead and get started. And thank you again for joining this call. I'm really excited that all of y'all are here. And again, my name is Jen Broyles. I am a certified holistic health coach, and I specialize in digestive wellness, things like IBS in particular, and other digestive issues. But tonight we're going to speak specifically about IBS and what the primary cause of IBS is. And I got to tell you, like this information is so fascinating to me because I know years ago when I was diagnosed with IBS, I thought I was going to be given the cure and start to feel better immediately. But the problem is that doctors didn't really know what the cause of my IBS was. And so I didn't find much relief. And so I'm so excited that now research is kind of progressing in this area and starting to uncover some information that's leading to a definitive cause that we can actually treat. So really, really interesting stuff, and I hope you benefit from this as well. And if at any point during this presentation you guys have questions, feel free to type those in the chat box that you should have on your right sidebar, and I will be sure to get to all the questions at the end. So we'll go ahead and dive in. I want to be respectful of your time, so go ahead and get started. So as I was saying, years ago, over 10 years ago now, when I was diagnosed with IBS, I thought, oh, what a relief. They know what it is. I'm going to be healed. But unfortunately, that was not the case because many of us, you may be one of these people that have possibly received a diagnosis of irritable bowel syndrome from your doctor. And ultimately what that means is that they've probably run some other tests, maybe some blood work, maybe some more invasive tests like a colonoscopy or an endoscopy to rule out other conditions such as Crohn's, colitis, celiac, other types of digestive issues, and everything's come back negative. And so you're left with, oh, you have IBS. That's basically just a diagnosis of exclusion, meaning that the doctor has no clue what's going on. And for years, doctors pretty much attributed IBS to stress. They said, oh, just, minimize your stress, learn how to manage your stress, because stress is causing your digestive issues. And that is so incredibly incorrect. And it's got to be frustrating too. I know it was frustrating for me, and I'm sure if you've ever heard that, oh, just manage your stress, or even if you've been told, oh, it's all in your head, that's frustrating, because that is not true. Even when you're not stressed out, chances are you still have digestive issues. And just one other scenario that's very similar to this is in the case of peptic ulcers or stomach ulcers. For years, doctors said, oh, these ulcers are caused by stress. You need to learn how to manage your stress. Well, it turns out that that is completely false, and that there's an infection called H. pylori, which causes these peptic ulcers. The thing is that stress tends to make those symptoms worse, just as it does in IBS. So while stress doesn't cause IBS, it can definitely worsen the symptoms. And I think a more accurate statement is that IBS causes stress. And I'm sure you can relate to that. If you've got chronic digestive issues and you don't have any answers and you're not finding any relief, then that's going to cause a lot of added stress and anxiety and worry and fear, and ultimately make your symptoms even worse. So I'm really excited that now research is coming along, recognizing that stress isn't the underlying cause, and we may actually know what is. So what is the cause of IBS? And much of this research has been led by Dr. Mark Pimentel and his team at Cedars-Sinai Medical Center. And he's really kind of devoted his career to IBS research. And now there is a ton of evidence that actually suggests that acute gastroenteritis, or more commonly known as food poisoning, is the ultimate cause of IBS. And I'm going to explain this because that may sound a little crazy. I mean, most of us have had at least one case of food poisoning, and you probably know a lot of people that don't have IBS that have also encountered food poisoning at one point in their life. So the interesting thing is, and unfortunately, if you're one of these people with IBS, it's estimated that roughly only about 10% of people that get food poisoning will develop IBS. So if you're listening to this call, I'm guessing you might be one of those 10%, just like I am. So, and that's okay, because now we've got some answers. So I'll explain kind of how all this works and how food poisoning can lead to IBS. So food poisoning, or acute gastroenteritis, actually decreases the motility in the intestine. And food poisoning, of course, is caused by ingestion of pathogenic bacteria. And there's hundreds of different pathogens out there. Some of the more common ones that we hear about are things like Campylobacter, E. coli, Salmonella. So all of these pathogens, can be in improperly prepared food or bad water or something like that, and it gets into our system and infects us. And then we, develop a case of food poisoning, and we're not feeling too hot for a day or two. So when this happens, the bacteria that has infected you, it actually secretes a toxin. And this toxin is called cytolethal distending toxin, and we're going to call it CDT for short. But what happens is that your body starts fighting this toxin. Your immune system ramps up and starts fighting this toxin by producing antibodies, which is fantastic. That's exactly what your immune system is designed to do. It wants to fight off this toxin and kill it so you can recover and start feeling better. The problem with this, however, is that this CDT toxin looks very, very similar to some of the nerve cells in our small intestine. And these cells are called ICC cells. The full name, and I'm not sure why they're named this, I'll have to find that out, but they're called interstitial cell of Cajal. And so through this presentation, we're going to call them ICC cells because that's a little easier to say. But the CDT toxin looks extremely similar to this nerve cell in our small intestine. And the reason that matters is because these ICC cells are extremely important for proper functioning of our small intestine and digestion. And they are actually responsible for what's called the migrating motor complex. And this function, known as a migrating motor complex, it's a sweeping action in our small intestine that keeps bacteria and toxins from accumulating. So periodically, just by itself, the migrating motor complex goes into effect and starts sweeping bacteria and toxins out of the small intestine because they're not supposed to be there. And so the CDT toxin is actually kind of causing an autoimmune response in our bodies because our immune system is trying to fight the CDT toxin and it starts fighting healthy ICC cells. So we're learning now that IBS can be seen as an autoimmune condition because our bodies start attacking healthy cells. And at that point, if the damage to the cells is bad enough, SIBO will develop. And again, SIBO stands for small intestinal bacterial overgrowth. And you'll experience at this point symptoms of bloating, gas, altered bowel function, all of those typical IBS symptoms that you might be experiencing. So there are a couple of causes of SIBO. The main one is what we're talking about tonight, and that is decreased motility caused by food poisoning. And really anything that allows bacteria to back up and accumulate in the small intestine can lead to SIBO. So in this case, we're talking about decreased motility. Some other things are physical obstruction. If you've got something blocking the path in the small intestine, that can cause a backup of bacteria. Also, non-draining pockets, which are diverticula in the small intestine, can lead to SIBO. But for our purposes tonight, we're going to speak specifically to food poisoning that causes a decrease in motility. It attacks your healthy ICC cells. It disrupts your migrating motor complex, and then allows for a buildup of bacteria to accumulate in the small intestine. And many of you may know as humans, we are made up of a ton of bacterial cells. There are 100 times more bacterial cells in the human body than there are human cells. So we are truly more bacteria than we are human cells. And most of these bacteria reside in the colon. That is really the home for the majority of the bacteria that make up us. And SIBO happens when bacteria from the colon start to migrate up into the small intestine and they begin to overgrow. And there are a couple of problems with this. So there are certain bacteria that live in the small intestine, not a whole lot, very small amounts, and they're completely different types of bacteria than the bacteria that live in the colon. So when this colon bacteria starts to migrate up to the small intestine and start making its home there, it's in a foreign place and it's somewhere it shouldn't be, and it starts to cause a lot of uncomfortable symptoms. And so some of the typical SIBO symptoms are really synonymous to your typical IBS symptoms. So bloating, distension, cramping, constipation, diarrhea, that altered bowel function. Some of us are mainly constipated, others experience more diarrhea. Some people fluctuate in between the two. It's different for everybody. Abdominal pain is another big one. Acid reflux, nausea, burping, flatulence, all of these symptoms are strongly linked to SIBO. And I will say the most common complaints in patients that have SIBO are bloating and distension. And there are some additional symptoms as well that may not even seem related to SIBO, because SIBO can start to affect other parts of the body and it can really become a more systemic condition. And so this is a very short list. There's actually a whole host of conditions and diseases that have been linked to SIBO, but some are food sensitivities, headaches, joint pain, fatigue, leaky gut, anemia, and that could be iron deficiency or B12 deficiency, weight gain or weight loss, rosacea, depression and anxiety, autoimmune disease, GERD, and autism, just to name a few. So you may be thinking right now, okay, so I have these symptoms that really sound like SIBO. I haven't been able to get any answers or find relief. So how do I know if I really have SIBO? And so there is a way to test for it. And it's actually a pretty easy test. It's not invasive at all. And it's called a hydrogen breath test. And this is considered the gold standard for diagnosing SIBO. And it's basically a 3-hour test. You'll drink water with this substrate mixed into it. You'll drink it, and then every 20 minutes for 3 hours, you'll blow into a bag, and it will collect your breath. And it basically measures the levels of 2 different types of gas that bacteria will emit. And so if your levels are high enough, then that will indicate that you do have a bacterial overgrowth. Now, there are 2 versions of this breath test, and it's based on the type of substrate that you drink. And one is lactulose and one is glucose. Now, if you're going to do this test, I highly recommend that you request the lactulose version, because it is the preferred method for testing for SIBO, because it will test for bacterial overgrowth in the lower part of your small intestine, and that's really a much more common place to have bacterial overgrowth, because if it's coming up from the colon, then chances are it's going to reside in that lower part of your small intestine. The glucose test only will measure for bacterial overgrowth in the upper part of your small intestine, and that is not nearly as common. So if you do the glucose version, you could very well get a false negative. So I definitely recommend requesting the lactulose version. And that particular test with the lactulose substrate does have to be ordered by a practitioner with prescribing rights, because lactulose is considered a prescription. So, so just keep that in mind. Next time you go to your doctor, ask about the hydrogen breath test and see if it's something your doctor offers, or perhaps a local hospital. But if you have IBS and you haven't really gotten any answers or any specific diagnosis, then this is a test that you may definitely want to consider. So once you test for SIBO, you've done your hydrogen breath test. I just want to run through how to interpret the test, and just so you know, as an informed patient, how to interpret this test. Another thing to make sure of when you do this test is that the test will check for both hydrogen and methane gas. And so again, these are 2 gases that are produced by bacteria. And so that's the whole point, is we want to measure the amounts of these gases that are in your breath, because that will indicate if there's a lot of bacteria that are overgrowing in the small intestine. So the 2 gases that you want to measure are hydrogen and methane. And if your test is more hydrogen predominant, chances are that you are experiencing more diarrhea. So the high hydrogen levels and diarrhea have been linked. And then high methane levels have been associated with constipation. And a positive test is when hydrogen levels are greater than 20 parts per million, or methane levels are greater than 3 parts per million, or you have a total combined score of 15 parts per million or higher. All of those results would be considered positive, and so you'd want to start treating that bacterial overgrowth. And in terms of treatment, there are several options. And one of the things that you can start to implement right away is diet. Diet is a great place to start, because it can really help you start reducing your symptoms. If you're experiencing a lot of bloating and gas and abdominal pain and altered bowel function, diet can really help reduce those symptoms. However, a lot of times, depending on the severity of your condition, a lot of times diet alone is not enough. Again, it's a great place to start, but I do highly recommend getting tested so you can get on a treatment protocol that involves either pharmaceuticals or herbal antibiotics to really help kill off the infection. But like I said, diet is something you can implement right away. So there are a few diets that have been shown to be very effective for SIBO and just helping reduce the symptoms. And so I'll go through them kind of very high level, and feel free to, Google these diets and see what they consist of. But the first is, they're both versions of paleo. So you may be familiar with the paleo diet, but these are specific protocols that are similar to paleo, but they also take out other foods that can tend to be problematic. So one is the autoimmune protocol, and the other is, it's called the specific carbohydrate diet. And I will say the specific carbohydrate diet has been well researched and just proven to be phenomenal for all types of digestive issues. It's been around for years. It's a great option for IBS. Also, it's been proven to be fantastic for Crohn's, colitis, diverticulitis, celiac, and just a wide range of digestive issues. So the kind of the features of these two diets is that you're removing difficult to digest carbohydrates, because again, sugar and carbs are what feed the bacteria. So we want to limit those, and especially the more difficult to digest ones, the ones that aren't absorbed very quickly, because those are the ones that are going to make their way down further into your small intestine and start to feed that overgrowth of bacteria. So we're removing those difficult to digest carbs, taking out things like grains and lactose and legumes, and of course no sugar, especially like refined processed sugar. Really the only sweetener that is allowed is pure honey, ideally raw honey, because it tends to be pretty well tolerated, and it has a lot of nutritional value as well. Another diet that is extremely popular and has been, it's generally recommended for IBS. If you go to a gastroenterologist, this is one diet that is recognized by conventional practitioners to be helpful for managing IBS. And specifically SIBO, and it's called the low FODMAPs diet. And FODMAP stands for fermentable oligo di and monosaccharides and polyols, and that is a very long, long phrase. But essentially, these are different types of sugars. They're short chain carbohydrates, and FODMAPs are poorly absorbed in the small intestine, and so they can start to make their way down into the lower part of the small intestine and ferment in the gut, and they start to feed that bacteria, and that causes a worsening of symptoms. So taking out foods that are high in FODMAPs can help reduce your symptoms. And in terms of the low FODMAPs diet, you can go and Google low FODMAP diet or low FODMAP food list, and it'll come up with a whole list of foods that are approved on a low FODMAP diet. Now, I like to take this a step further and do more of a low FODMAP paleo version, because the problem with the general low FODMAPs diet is that it still allows gluten-free grains and a pretty good variety of processed foods, which I just don't think are going to be helpful in managing symptoms and treating this condition. We really want to focus on whole foods, natural foods, nothing processed, nothing refined, and really taking out all grains, and even like pseudo grains, those grain-like products like corn and quinoa, can just really take it to the next level and significantly help out. So that tends to be what I recommend more, is a paleo version of the low FODMAPs diet. So another dietary treatment is called the elemental diet. And this is usually a last resort option because it's very, very difficult to do. The elemental diet is basically nutrients in powdered form, and you mix this powder with water and you drink it. And everything in it is pre-digested. So it makes it very easy to be absorbed, and all the nutrients are absorbed before reaching the bacteria. The hard part is that you drink this for 2 weeks and you don't have any food. You have nothing but these drinks, because they are, completely full of the nutrients that you need to get by. But yeah, you drink nothing but this for 2 weeks, no food, no nothing. And the drinks are not good. They don't taste good at all. So it's a very difficult protocol to do. That's why I say it's usually a last resort. But the good thing about this is that it is very effective, because you're basically starving the bacteria, but nourishing your body at the same time. So, it's a pretty quick protocol, 2 weeks, and it's been proven to be very effective. And then, like I said, diet is a great place to start. It's something you can implement right away, but a lot of times, treating SIBO will require some sort of antibiotic protocol. And you've got a couple of options. There's a pharmaceutical route, and there's, a more natural herbal route. And if you go the herbal route, there's actually studies out there that show it's just as effective as the pharmaceutical route. It does take a little more time. Generally, an herbal protocol is, like a 60-day period where you'll be on these supplements. And, I highly recommend that you work with a practitioner to go through this if you choose the herbal route, because the dosing on all of these different supplements is very high dosing, and you just want to make sure that you get the balance right. But a few supplements that have been used in treating SIBO are things like oil of oregano, allicin, which allicin is garlic. Both of these have very strong antibacterial, antimicrobial properties. Berberine containing herbs such as golden seal is a phenomenal option. And it's very important too that you follow up your protocol with what's called a prokinetic, and that just kind of helps reactivate that migrating motor complex. And so you do your herbal protocol, followed up with a prokinetic. And another very important thing to make sure you do after you do any type of treatment, whether it's pharmaceutical or herbal, is to retest. You want to make sure this infection is gone and not just assume it's gone. So definitely retest after you've gone through the protocol to confirm that everything's been killed off. And then, like I said, there's a pharmaceutical option as well. And honestly, we hear so much, negative stuff about antibiotics. And generally, I say avoid antibiotics if you can. But in this case, the antibiotics that are used to treat SIBO have been shown to be very safe. They are absorbed in the small intestine where they're intended to work. And so they don't really have any side effects. They don't have a negative side effect profile. And so in terms of antibiotics, they're pretty clean. And this protocol has been proven to be very effective at eradicating SIBO as well. So the protocol is different depending on how you test. So if your results show that you're hydrogen positive, then the protocol would be a round of rifaximin, and the brand name for this drug is Xifaxan. And it's recommended that you take 550 milligrams 3 times a day for 10 days. And if you're methane positive, then you'll actually take 2 agents. You'll take rifaximin along with neomycin. And the dose on rifaximin is the same. Neomycin, you'll do 500 milligrams twice a day for 10 days. And then you'll follow that up with erythromycin, which is your prokinetic, at 50 milligrams for 3 to 6 months, okay? So this is great information that you can take to your doctor and, talk to your doctor about if you do suspect SIBO. So I want to also give you some tips for avoiding SIBO in the future, because this is an infection that can recur. And so it's very important that once you treat it and you start feeling better, that you're able to maintain that. And one of the most important things is to maintain that healthy diet. Limit your carb intake, avoid processed foods, avoid refined sugars, and just keep a very healthy whole foods diet. A paleo style diet is a great way to go, where you are consuming a lot of clean animal protein, lots of vegetables and fruits, and no grains, or either very minimal grains, and definitely no gluten, and no lactose, generally speaking. Some people can tolerate other forms of dairy like butter and hard cheeses, which are low in lactose, but, kind of staying away from the sugar and the lactose and the refined foods and the high carb items is a really, really good way to go. Also avoiding any type of acid blocking drug, such as a proton pump inhibitor like Nexium or Prilosec, or, you know, even some of the other agents like Tums and things like that, because those can actually, you know, they're linked to SIBO as well. Limit your alcohol intake. Whenever you're traveling, or if you get a case of food poisoning, a good supplement to take is Alimed. That's a high dose form of allicin or garlic, so it can really help fight that off. And also eat fermented foods and take probiotics, and that will really help build up that good gut flora, and it will really help promote motility as well. So just a few tips for avoiding SIBO in the future once you treat it, so you can continue feeling great and healthy. And so another option as well is, you know, I've been specializing in digestive wellness. I've been through all of this, so I totally feel your pain if you're kind of feeling stuck. And so one of the things that I can offer you is a fantastic online program to really help you get started in healing your gut and get you on a protocol that can really help you feel better and kind of guide you along the whole process of what you can do to uncover the root cause. So it's called the Heal Your Digestion program. It's completely online, and it comes with a ton of great resources. It really is kind of like a step-by-step guide to healing your gut, uncovering the root cause, and just restoring your health and reducing and healing IBS. So it includes a fantastic gut healing food guide. So you get a whole food list of foods that you want to consume and then foods you want to eliminate, along with recipe guide and a meal plan and all kinds of great stuff to get you started there. It also comes with some fantastic supplement recommendations to really help promote gut healing. You'll get a gut infection guide that will walk you through, you know, several different types of very common gut infections. SIBO is one of them, but there's also the chance of parasites and candida overgrowth and even pathogenic bacteria. So we kind of touch on all of these and discuss different testing for each of those types of infections, because it's so important that you get to the root cause so you can actually treat that rather than just trying to manage your symptoms day in and day out. We talk a lot about the link between adrenal health and gut health. And so it comes with an adrenal support guide to help you restore your adrenals, because if your adrenals are suffering and they're fatigued, then it's going to be very difficult to heal your gut. You have to have strong adrenals to produce the necessary hormones to really help fight infections and heal your gut. Again, it comes with sample meal plan, recipes, videos, tutorials, and just a lot more. We have a private online forum where you can ask questions, and it's just a really great program over a 40-day period. So if that's something you're interested in to really help guide you and hold you accountable, then we'd love to have you in our group. And since you're on this call live, I am offering a pretty awesome special for it as well. So you can go to the site, jenbroyles.com/heal your digestion program. And you can actually save $200 if since you've been on this live call. And the normal price is $297. I'm knocking $200 off. I'm giving you a coupon code, HYD200. You just enter that at checkout and you save $200 off the entire cost of the program, which is pretty amazing. So would love to have you guys participate. It's really awesome, and I think you'll really, really enjoy it. Another thing that might be of interest to you is I do offer private coaching. So if you're really wanting that more one-on-one accountability and personalization, then that's something that you might consider as well. So feel free to go to my website and just check out those different offers. And if you have any questions or want to schedule a free 20-minute consultation, I'm happy to do that as well. So you can always email me at jen@jenbroyles.com, and I'm happy to set up a 20-minute phone call with you to answer any questions that you might have. But for now, I do want to go ahead and open it up for questions. If you guys have any questions, I'll take those now. I know I got a message saying the sound was cutting in and out. Are y'all able to hear me? Okay, great. It seems like there is sound, so maybe it's just one person that's having some issues with the sound. So I'm glad you guys have been able to hear me. I'll give it a couple more minutes. Oh, I got one question. Should I be taking probiotics while working to heal SIBO? Yes, absolutely. If you can tolerate them. I will say that some people with SIBO tend to experience worse symptoms when they take probiotics. Um, but if they seem to help you, because probiotics can really help with motility and just strengthening the immune system. So I do recommend taking probiotics while you're working to heal SIBO if 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 you tolerate them. And it seems that I may be having sound issues. Okay, sound is back. Okay, I'm sorry, y'all. I don't know what's going on. Okay. Okay, so Julie had asked a question about taking probiotics. Julie, if you didn't hear my answer, I said yes, taking probiotics is definitely ideal while you're working to heal SIBO if it's something you tolerate. Some people don't do so well taking probiotics when they have SIBO. They experience a worsening of symptoms. If that's the case, I would back off on them. But if you tolerate them well, then I would definitely encourage taking probiotics because it does help strengthen the immune system and really help promote motility. So I think taking probiotics is great while you're working to heal SIBO. All right, are there any other questions? All right, wonderful. I will go ahead and tell you a good resource to go to if you want to read up more on SIBO is a website called siboinfo.com. There's a lot of great resources there that may help you out. So check out that website as well. All right. Well, if there are no other questions, I'll go ahead and let y'all go. But thank you so much for attending. It was such a pleasure chatting with y'all. I hope you were able to hear most of it. I don't know what was going on with the sound issues. But again, feel free to email me directly if you have any questions or would like to set up a 20-minute consult. Or I'd love to see you in the Heal Your Digestion program as well. So y'all have a great evening. Take care. We'll talk soon. Bye.